Hello and welcome to another episode of Talks with Kalpana, where we bridge CXO agendas with innovations, spotlighting global CXOs. Today we have a very special guest joining us. We are thrilled to have Sumit Puri, the CEO and co-founder of Prana Wellness and Chief Information Officer at Careful. Sumit brings a wealth of experience in digital transformation and wellness innovation. Welcome, Sumit.
Many thanks, Kalpana ji, for inviting me. Absolute pleasure to be here.
Our pleasure too. Sumit, let's start with your journey. Can you share with our audience a bit about your background and how you come to co-found Prana Wellness while also taking on the role of CIO at Careful?
Sure. I have about 30 years of experience in consulting, insurance, and healthcare sectors across various countries. And I started off, in PwC after my MBA from IIM Bangalore. Then spent about 5 years in GE in various roles as I was the global digitization leader for enabling functions when digital transformation just started. This is back in 2000. And after GE, I moved to Prudential, 10 years in Prudential Insurance, 4 years in ICICI Prudential, 6 years in Southeast Asia as CIO for Prudential Indonesia, and then, in a regional role. And after that, spent time in hospitals, CIO for Max Hospitals. We grew to become the most digital hospital in India. This is from 2015 to 19. And post that, I came to Dubai as the group CIO for Evercare. And while I was here and doing multiple large projects, enterprise projects, large initiatives, COVID happened. And that's when I got interested in wellness. And we saw how the world was brought to its knees, by health issue, like a virus pandemic. And I really felt that this is the time probably, I should also try and do something around this. And that's how Prana Wellness happened. It originated from there. And wellness is the key for us. Prevention. We're talking about actually preventing some of those problems, some of the illnesses that we see. So Prana Wellness was a germination of that journey of how do you really create a very good AI-based ecosystem by which we can prevent illnesses, prevent chronic lifestyle issues. And that's a brief about myself.
Well, that's quite fascinating. Let's talk about the current landscape. Like, according to you, what are the most significant trends currently shaping the healthcare and wellness industry?
So I think the first thing I would say is there's a lot more need for personalized medicine. Because today one size does not fit all. We all are unique, and we do need a lot more, understanding at a much more holistic level to improve our health and well-being. So that's one thing. I'm talking about personalization. I'm talking about personalized medicine. The other element is a lot of that, kind of also is going to be in a way possible through new age technologies, because there's a lot more, technology improvements that have happened in the last few years. Artificial intelligence, Gen AI, genomics, you have big data. Many of these new age technologies have come to the fore, which have helped make geography history, with the cloud also coming to the fore. So to me, those are interesting initiatives. I see elements like this, technology, personalization, and to some extent, I would say also changing expectations. We look at the younger population, they are looking at a very different experience from healthcare. They are brought up, over the smartphones and apps and convenience. They want a hotel-like experience even in hospitals. So there is changing demand, changing customer expectations, changing profiles, which also is contributing to a shift in the way healthcare and well-being needs to be delivered. So that's a few things I would probably just say. But all of this is being spurred and facilitated by the rapid developments in technology, which to me is great. Really speaking, there is a lot of opportunity, a lot of potential in utilizing the technology there. And I would also say it is not only about customers, it is also about the new age doctors who are coming to the fore. So that's another element that will probably be very interesting to watch, because the new age doctors will be people who are actually born with technology. They already learned technology from the very beginning. So they will really make a big difference because they will embrace these changes wholeheartedly. and will completely transform the way healthcare can be delivered to people. Because to me, I mean, today the big thing here is making healthcare truly about well-being, about actually enhancing health, not about sick care. That's what I would probably like to say.
Yeah, sure. So now it's more about not just the patient care, but also the experience that doctors are having, the healthcare
Absolutely,
providers, basically.
absolutely, absolutely, absolutely.
So, given your extensive experience in healthcare sector, what are some of the biggest challenges facing the healthcare and wellness sectors today, and how can they be addressed?
I think the biggest challenge I do see is, and we just briefly touched upon it, is the fact that today there is still some reluctance of doctors and also of management teams to basically embrace some of the changes that they're seeing around themselves. I would say that is one big problem, and there is a need to say that that you can in a way get some more insights with the help of additional inputs from technology. Of course, that's one area that I see. So the first thing is more about the changing mindset. We do need to change mindsets. COVID has changed a lot of mindsets. We've never felt. I mean, I remember in Max hospitals, in Evercare hospitals, we had a very difficult time convincing doctors to embrace telemedicine, to embrace video consults. Very tough to get them to do that. I mean, people were willing to travel 4 hours in the morning and 4 hours in the night or next day morning to come to visit some small remote place to see patients. They were not willing to do this on teleconsult. COVID changed all that because there was a lot of realization that this can work. So to me, yes, there is the challenge is the mindset about how do you embrace the new changes that you see in front of you. Second element I would say is I think there is a big reluctance to be very transparent about outcomes. I mean, it's no problem to basically share these outcomes very clearly, transparently, because that helps us become better. I've not seen very many hospitals today enter outcomes in their electronic health record systems or in their hospital information systems, which is so important because you do need to measure to manage. Where exactly did we probably, go wrong? In some cases, I'm not saying there's no finger point, no blame game, but there is a need to track these outcomes and improve them as we go forward. So that's another challenge which is clearly there, that there's no tracking of outcomes. When we are looking at most of the healthcare services, we don't know, it's a black box. That has to change. In many European countries, in US today, insurance has started paying based on outcomes. So to me, it is important that we have that aspect, that transparency also coming to the fore. So that's another thing. How do you really enhance transparency in outcomes, which is one more challenge? And third, I think there is a problem also in skill sets, in standardization of skill sets, and making sure the protocols are being followed across levels. And there's a lot more training and development and learning that is done to the nurses, to the medical practitioners, to the staff that come in to ensure very, very good quality of care to the customers, because that is also sometimes inconsistent. There are a lot of attrition issues, a lot of and manpower issues that happen in time, and that does affect patient care and safety. So those are elements that we have to kind of bridge and improve.
Yeah, sure. So, what could be the solutions possibly, because these are the challenges that you have mentioned, and what are the ways to meet them?
Look, so to me, I think this has to be a continuum of care. And I think it's absolutely critical that all key people, all key players in this ecosystem work together. Whether it is, insurance, whether it is healthcare providers, whether it is wellness providers, whether it is the doctors and, nurses, and of course also management teams, they have to work together to provide the best care to the customer. And that is where I see a lot of gaps today. There is fair amount of back and forth that happens between insurance and healthcare organizations. Significant challenges, significant rejections that keep happening because insurance feels the bills are inflated, healthcare feels that genuine claims are being rejected. There's a lot of leakages also which happen in between. There is lack of transparency in what was actually done for the customer. So to me, if we can bridge these gaps, bring it together, in a continuum of care. And that is, again, possible with technology, with the cooperation and collaboration between various stakeholders, where we are saying, look, let's kind of pool in, our resources and make it a lot more easier to make this more efficient, because today's healthcare costs are not sustainable. Whether it is diagnosis, you keep on adding more diagnostic tests, or we keep on doing a lot more, let's say, additional, procedures. That is not the best option and best use of resources. I mean, many of the developing countries do not have the resources, and now even developed countries don't. With the economic condition that we see in many countries, it's very important that we optimize use of resources. So to me, it is about bringing people together. Of course, having a technology providing, insights. Today, AI can actually bring in so much more of information. Today, millions of, outcomes can be collated and brought in front of the doctor to augment his judgment. If I look at making a patient, a participant in his wellness journey, because he's the person who's most effective. And we all know how much time a doctor has today in, let's say, the busy hospitals of India, for example. I mean, you have a doctor in Safdarjung or a medical or, some of the big government hospitals seeing probably 50 patients in an hour. You hardly have 2 minutes, 3 minutes with each patient to look at him. How can he understand symptoms very well and diagnose the patient very well? Yes, they have huge experience. But imagine if this was entered using, let's say, a very good digital system where all the symptoms are entered by the customer and AI gives you, a draft provisional diagnosis, which can be validated by the doctor. The doctor is the one who takes the final judgment. So this is augmenting the doctor. Now, that's possible today. You can actually enhance your accuracy of estimates using AI. What is the estimated cost of surgery? You can actually do that very well. We did that during Max times. We did that in even Evercare. You can actually reduce the cost of healthcare in general. And third, I think a lot of focus on prevention. We have to start making prevention a core of healthcare. Primary care, secondary care in conjunction with AI-based wellness apps and also wellness centers, where we're enabling a continuum of care, actually trying to ensure that issues are caught early. Why is it that we have to look at a diabetic patient only when he has a HbA1c of 7.5? Why not at 5.7 when he's pre-diabetic? Why can we not have early alerts? Which is where the wellness apps can help. Prana AI, the company I have founded, actually has this app called Prana AI, which is trying to alert you and measure the wellness in time. Those are the things that we will need when we are really looking at enabling true healthcare. To me, that's what is needed.
So could you just tell us more about the Prana Wellness and the more about the apps?
Sure. So look, today, I mean, what we are trying to do is we are trying to make this, make wellness in some ways more simple, more affordable, and clinically effective. Because, today there's a lot of shams that happen in the name of wellness. If I really look at, the way we would like wellness to be, we want you to be the best version of yourself. That's what it is. And we can make that happen with simple hacks. With, let's say, if I was to give you a wellness score for yourself, and then I also tell you that across dimension, because wellness is not only about one area. Let's say somebody tells you, please work on your nutrition and you'll be fine. Somebody tells you, just exercise, you'll be okay. Somebody says, don't worry about anything else. You'll be fine. Don't just manage your stress, reduce your weight. These are not the right metrics because all of these things are connected. We need to connect the dots to make you the best version of yourself. If you are stressed, you will not exercise. If you actually have a real problem sleeping, you will not wake up refreshed in the morning and you will not be able to even eat well or even exercise well. All of these things are connected. If you're living in a place where the air is not pure, where you actually have a lot of challenges, even in the right kind of water you drink, you don't get sunlight, you're actually not even getting refreshment there. It is going to affect your health. We are simply saying, can we connect the dots? And we also get integrated functional medicine doctors to advise you if you have a low score in a particular dimension. We're going to help you in the dimension you need most. We're going to personalize healthcare for you as per your need and actually enable this in a very simple, very effective, very affordable manner. So prana is a way to keep the doctor away. That's what we're trying. And I'm saying we want to make doctors our partners. Wherever you need, all of the hospitals and doctors play a very important part. But it is not needed for everybody. Tertiary and quaternary hospitals and the advanced care, we have limited doctors across the world. And we do need to have them spend their time on the people who need it most. Those 10%, 20% people who actually need surgical interventions, procedures, or right kind of quaternary advanced care, they are the ones who should go there. But a lot of the other cases can be prevented. They are wholly reversible. Today, in the world, 50% of people suffer from chronic lifestyle issues. And 90%, almost 85, 90% of these chronic lifestyle issues, like diabetes, like cardiac, like hypertension, like thyroid, these are all preventable. These are completely preventable with the right exercise, right diet, right stress management, and of course, environment. All of this is manageable. And we are trying to use AI to help you manage this, augmenting doctors, augmenting the care providers. So that's what the journey is. And our expectation is that we can really make a mark along with all relevant players in the ecosystem, because I really think there is a lot that can be done together.
Sure. So Prana is all digital or
Tana is a digital and a physical model. It is a hybrid model. We basically do events. We can actually also have in corporates or in groups, we actually come and tell you about the best practices in activity, in nutrition, in sleep, in stress management. And stress could be financial and emotional. We also give you some inputs about how to manage your money better, how to manage your emotions better, how to meditate, stuff like this. But there are practices that are very important. Along with this, we basically have an app, and this app can sustain you, because many times you go to a wellness resort, and that wellness resort, you might spend a few days, maybe a week, and then you come back and you go back into the old routines, old habits. How do you sustain? So Prana is that app which will allow you to sustain those habits, to keep them going, to really become the version of yourself which you really have always aspired to be. So that is what we are hoping to do. So it's about combining technology with experts, the right experts in lifestyle medicine, right nutritionists, right life coaches, fitness coaches, combining that with technology. And for us, everyone who is an expert is welcome to partner with us to kind of create a very interesting and holistic ecosystem for customers to basically avoid and prevent those illnesses that bring you to the ICU and to the IPDs. And like I said, this is all doable. It just needs the right kind of partnerships and right kind of mindset.
yeah, sure. So how can wellness programs be effectively integrated into corporate environments to enhance employee health and productivity?
I think the biggest thing that can be done is that this should be made, as a community. We are talking about our wellness communities. We are trying to leverage the power of community. So when I look at, let's say, for example, we run challenges. Prana AI, we are running challenges. And again, there are also personalized goals that we will set for you. But, of course, from a challenge perspective, it's the power of community that can really be brought to the fore. I have seen many organizations where people just say, if I was to basically look at, let's say, a yoga day on 22nd of June, and we do that yoga day and we are done, the tick in the box by which, the HR team has done its part. And maybe the next time they're available is in September, where they have some time and they can organize another, let's say, fitness day or something. Now, it doesn't work that way. Wellness does not work that way. Wellness is a continuity of your health and wellness initiatives. So only with the technology, only with an app can you deliver that continuous care. So we're saying if corporates choose to partner with us or companies like us, they could get a complete program for their employees. So while they conduct the events, maybe once a month or once a quarter, you have the app to support, and you have maybe a consult with a psychologist or a nutritionist or a lifestyle doctor once a month to give you more advice, basis your achievement on the personalized goals that have been set for you. So we are simply saying, let's make it a journey which is done in a very simple manner with the right inputs at the right time and technology aiding every step of the journey. Supposing I have AI based fitness. Now, when somebody is traveling and he basically is not able to consult his fitness trainer or go to his gym, how do you manage your fitness? If you have an AI based fitness app that allows you to be accessing those same routines in the place you're traveling, just with the phone. Your wellness is in your pocket. You can travel with it anywhere you want. We are simply saying this can be enabled. Similarly, AI based nutrition, AI based emotional wellness. How can we enable that? Can I actually have a companion, a buddy, which can connect with you and give you some advice? We're saying these are things that really will help you. So for us, it is about creating that ecosystem that allows you to become a much more better version of yourself, working with the corporate HR teams to enhance productivity of the organization, to reduce sick leaves, to reduce claims, and in our expectation, this would also help insurance premiums coming down, because you will see these corporates will see a lot more productive workforce, a lot more engaged workforce, a lot more happier workforce. So we see a lot of potential in collaboration.
Yeah, sure. So, what are the key trends in preventive healthcare and how can they contribute to reducing overall healthcare costs? Though you have highlighted quite a few while explaining the benefits of the app, and especially when we implement them in the corporate culture.
So a lot of now advancements happening in precision medicine. A lot of new variables that have come to the fore. IoT variables that can detect a lot of information. You've got very interesting devices that can be very useful to track and measure, your health and well-being. I would also say the importance of big data. Today, by using analytics, you can really get a lot more understanding, of what are the treatment protocols that have actually benefited customers and which have not. I think besides all of this, I personally feel there is going to be a more and more increasing emergence of alternative medicine as well, because there are now technologies that are actually enabling people to biohack their wellness. So it doesn't have to be dependent only on large hospital chains, because many people can get well by knowing more about the right techniques, right protocols, right best practices, which is what we are also saying is possible with Prana AI, and of course with the right kind of wellness experts. But to me, those are things that can happen. Biohacking has become a huge industry in the US, in Europe, and it's coming to India. It's already there. And I think there is a lot of possibilities even in predictive diagnosis, as I was mentioning earlier, using AI. And there is changing the way today people are getting screened, because the screening itself can become much more useful, much more convenient. So I would say we can bracket it into enhancing overall outcomes using wearables, using personalized medicine, using new age technologies and AI and big data. And also, to me, good thing is that you can have a lot of actual benefits coming with the biohacking, with people, consumers becoming more aware of how to manage their health. So both these things will help technology and the awareness within the customers and within doctors as well. Today, doctors are also spearheading the cause of improving your nutrition and enhancing your sleep and enhancing your exercise. So it's a very interesting time where people are realizing the need to have all these things work step in step, work in conjunction, which would yield the best results.
So I think digital transformation can improve patient care and operational efficiency in healthcare industry. That's what we can understand. So, what are your top focus areas in terms of business priorities and tech priorities over the next 2 years?
So the biggest focus areas are one, of course, actually enabling customer care to the next level. Enabling prevention. Which actually allows people to live the best life that they can have and enhance their health span. I'm not only talking about lifespan, I'm talking about health span. How can they really live healthy and a young and a fulfilled life? That's the most important thing. And you want to take steps because AI will become even better as we have more data coming in. We'll become even more evolved in the way we're doing this. Second, you want to make sure we're protecting the data of the customer. It is data privacy, data security is so important. So that's another very important element for us to make sure that is very well taken care of. And third, we'd like to partner with the right kind of teams and companies and individuals who can, join us in this journey because it's a large problem to solve. It's not something which can be done alone. So for us, those are all elements that will come together. And finally, keeping a lookout on new emerging technologies, genomics, personalized medicine. How can we coexist? How can we co-create another level of wellness, for our users, for the population? Because for me, we'd like to democratize wellness, and in some ways make healthcare cost sustainable. So to me, making it affordable, making it accessible, making it clinically effective and simple is what the key focus is, and that's what we're aiming to do.
Yeah. So I think overall we can say the future of healthcare and wellness will be shaped by advancements in AI, genomics, and personalized medicines.
Absolutely, absolutely. And
Yeah.
we like I said, it is all about collaboration. It is all about bringing these technologies together to work in conjunction with the right kind of experts and the right kind of processes. And hopefully, we will have partners like Tech Plus Media to broadcast this message, to a larger audience, which would make it even more easier to bring everybody together and leverage the power of community, for this.
Sure, sure. So thank you, Sumit, for sharing your insights and experiences with us today. It's been a pleasure having you on the show.
Same here. Thank you, Ms. Kalpana. Thank you so much. And pleasure being here. Thank you.
And thank you to our audience for tuning in to Talks with Kalpana. Stay tuned for more enlightening discussions with industry leaders. Until next time, keep bridging agendas with innovations.
For more updates from CXO TV, please like and subscribe to our channel.